A tummy tuck or an abdominoplasty is a technique where we are removing redundant skin and subcutaneous tissue from the lower part of the abdomen and perhaps tightening up the abdominal wall. So a common person looking for this is a lady who has had her children. Pregnancy, although it produces a beautiful child for you, it also affects the contour of your abdomen. And women get very frustrated with the fact that they feel sloppy in the midsection, and if we can go in and remove that extra tissue and tighten up the abdominal wall, they have a nice flat contour afterwards, and it makes them feel much more confident and comfortable in their clothing. You don't want to do it when your weight is high. If you do the surgery when you're overweight and you end up shedding more weight after the surgery, you'll likely have to come back and remove some of the extra skin again. So it tends to be, if you're within about 10 pounds of your weight, that's reasonable for your frame size, and don't plan on losing more than that, you'll probably be happier than if you do it when you're heavier than that. The surgery itself can take as little as an hour and a half or up to 2.5 hours, depending on how much work that needs to be done. Oftentimes we do liposuction in the flank area at the same time to kind of contour that zone to help transition back to the hip region. If we have to tighten up the muscles, that adds a little bit more in terms of downtime and recovery and soreness. If we don't have to tighten the abdominal muscles, it's about a long weekend in terms of recovery.